I've been at Vice President Lizer here. Welcome to our December 29th COVID-19 Town Hall update. Appreciate you all joining in with us over the airwaves. Welcome to Facebook Live. As we always do, we open up with prayer. So we'll be receiving some great updates and some needed information from our health professionals, along with our own great leader, President Jonathan Nez. So first, if you would, let's bow our heads. Our Heavenly Father, Shitty and God, we thank you, Lord, for another day of life. We thank you, Lord, that we can come to you for every good thing and that, Lord, every thank you again. Looks like we have some technical difficulties, but we are flexible here at OPVP, and thank you. I appreciate our president's leadership, President Jonathan Nez, who's standing by, ready to give his update. So, ladies and gentlemen, the president of the Navajo Nation, Jonathan Nez.
Yeah, thank you, Vice President. And of course, we do have technical difficulties at times, so our apologies. The prayer wasn't picked up, but Vice President did open us up in a word of prayer, and he did also give us a little bit of words, and we're hopeful that he'll get into better signal range, or maybe it's on our end. We're looking into it right now. So we'll just start with our update, and thank you for tuning in. Many of you from all parts of the country and all parts of the Navajo Nation. This is Jonathan Nez, President of the Navajo Nation. We have one more town hall meeting this year in 2020, which will be Thursday at 10 a.m. and will be live at the Gallup Indian Medical Center on Thursday. And I'll come back to that in a bit. So thank you, Lloyd from Alamo, for tuning in. Dinah from Hogback, Delphine from Austin, Texas, and many more here on the Navajo Nation. We are going to give you some updates. So, Eli, if you could put up the chart there, or the PowerPoint, the slide. Today's numbers are slightly moderate. When I say that, we've been seeing some 300s and 200 or more daily cases. And so yesterday we do have 95 24 hours. So thank you, and good work to everyone. And then keep in mind, this is not counting the Christmas Day weekend numbers. So we are anticipating a increase. But how big of an increase, we'll soon see. And then 199,340 total tests, and these are tests that are beginning to duplicate. Many individuals, especially frontline workers, have received more than one test, so that also is included in this total tests completed. And so we're going to start breaking that down a little bit more. But overall, since the start of the pandemic, 22,371 individuals here on the Navajo Nation. That's not Navajos off the Navajo Nation that are living off the Navajo Nation, but on the Navajo Nation residents, 22,371 have tested positive. Those are the confirmed cases. 777 people, our loved ones, our family members, our friends here on the Navajo Nation have passed from complication to COVID-19. Our thoughts and prayers go out to the families, the friends, and the communities across the Navajo Nation. And as you see on the slide there, the breakdown of cases in the 8 service areas, that's includes the border towns too. So the border towns here is not counted on the top portion of the tests and the positive cases and everything indicated in the top portion. But you got Chinle, you got Crown Point, you got Fort Defiance, Gallup, Kayenta, Shiprock, Tube City, and Winslow. So Kareya, Kon, Hikeni, Hinna, the tested up Delia, Asa Nesna, Dindo, Nast a Dindo, but Nast a the Miliaj, Do Tra Nesna Dindo, Disdin, and El a Kon. Hikeni Hinna, the Kosentragen hast Eitzata, but that does not. So Sai Ayat Endasling. Ayat endaslingi ya asa at the media jdo din as a din on has a din on din in el tel econ he can he never that dog not do ayat endasling jo doi the kosentragi bed halon da konde sa kon he can he na on the such that ido oyo bitsis das ti das lindy but that does nagi such that the zito la oyo bj disjoligi oyo bahas andazlin so sada niya komban hashne sada niya di tsata jelle ho e beaches do gas yat es yat dole ayat ens dole no bahda na kunde the Saeya the Betisen between das the account the car, Asian but so deals and dollar. Aron nothing double on a kit. The melia double on tratness and thing double on. Septin double on Asanet icon the Kosentragina states at the Pitolna. So ainly Ishni at or the change a also con ni Kenny in Abidjan does the door the Kosentragi, but the door Nagi a ya hota. The Kodao Banda Wilna Nakijinda National door Dijinda National. So the Hagi at 2020 be Ashin Asla Nana Diet ho ato les Dijinda National. Le na George zel insa and ada shi hanne ich ko del neto le nezna pingo ol kilo so e on $1,000 doi ago del neto do del pingo nezna ol kilo dijin da national Thursday gonna so khana shi e ya da do kis do kodoshi e ya bada huil neto del next slide Eli. So the next slide, I like to show this slide, and Dr. Vaughn later on in the town hall will talk a little bit more about a lot of the information gathered by our EPI team, doing an outstanding job in getting information and data. So I know people will say, well, some of these provisions don't help. Masks don't help. I hear some people say, I hear people say lockdowns don't help, but the data doesn't lie. Take a look at the data and the statistics that gets presented to you. You know, we're not just telling you these things work. We're actually backing it up with the data that you see before you. Now you can see the chart there with let's say yellow, orange, brown line there. That's the Navajo Nation. And, you know, ladies and gentlemen, those of you that are on, I just got to note, those of you that are on the Facebook, please don't put up other links onto the Facebook, because some of these have viruses and we don't want other people to catch computer viruses because they're clicking on to these links. I'm sure some of you didn't know that, but now you do. So we're going to regulate that as well. And of course, if you use foul language or anything that crosses the lines, you know, you will be, comments will be taken off. So I just want to let everybody know. So if you look at the orange line there, that's the Navajo Nation. You can see that in, you know, April, May, you see a big spike, and then it goes down into the summer, and then boom, you know, Labor Day weekend, all the way up to the top. If you go to the right-hand side of the slide there, you can see the orange. You're starting to see a flattening of the curve, a downward trend happening here on Navajo. Now you look at the dark colored, either blue or black, depending on how it comes out on your computer. That's the United States of America. 3 spikes in cases, one in March, April, and another in July, and then the same one that we're going through right now. And you can see finally maybe a flattening of the curve, but you can see Navajo, based on what we've done, you know, with this, we're on our 6th weekend lockdown, and you know, these are protocols that were put in place that worked for us before. You know, why reinvent the wheel? It worked during the summer, and we are using that same philosophy here with the help of the public safety personnel. And you can see that, and of course the Navajo people listening to the health experts, and everybody abiding by the scientists and the doctors and the health professionals. Of course, our public safety personnel, our first responders. Many of them are having a difficult time, you know, they're burning out. Appreciate the volunteers that have come out from various places, federal government, Department of Defense, and nonprofits who've come to help relieve our healthcare workers. Even though it was maybe a few days, at least they got some rest. The reason why some of them had to leave because our numbers were flattening out and they were okay. And then all around us, you know that the hospitals were just overwhelmed. So they go where the need is, and they had to go and leave to other places around the nation, around the country to help them out. So on behalf of the Navajo people, I want to say thank you to those volunteers, healthcare. Some are still here, so don't get me wrong. There's some are still here helping out. And Dr. Jim will give us an overview of those volunteers when it's time for her to speak. So, all right, now, if we can start talking about the vaccines. The vaccines, we had Dr. Burla, the CEO of Pfizer, join us for a town hall meeting last week before Christmas. So we appreciate all the information that was brought to our attention. And just to give you an update, the first delivery of vaccines, 3,900 doses of Pfizer came to the Navajo Nation. And one vial, those little glass containers, have at the onset, they said 5 people could get a shot out of one vial. And then later on, they found out Pfizer and Department of Health and Human Services, CDC, said that you can actually get 6 or 7 doses out of one vial. So that was extra. So here on the Navajo Nation, from the first batch or the first delivery of Pfizer, we were able to give shots to 4,700 and more healthcare professionals out of the 33,900 original doses that were delivered. And it's because of the 6 and 7 in each vial. Some of the healthcare facilities used the extra doses to put in the arms of our healthcare. That's why 3,900 doses were delivered at one. There was a change. Now we know that over 4,700 of our healthcare workers were given a shot. So that's a plus. And majority of the first delivery of Pfizer are complete. We're doing an assessment now because we have 8 service areas, right, here on the Navajo Nation. Utah Navajo Health System, by the way, because of the advocacy of leaders, they're working through the state of Utah. We were able to bring some of those Pfizer doses to the Utah Navajo Health Systems there. And so they got shots as well, they're healthcare professionals, And so we're doing an assessment and give a better number of how many are still remaining. But what I hear is the majority, super majority of them, maybe over 90% of the 3,900 first delivery of Pfizer doses have been used up. We also got another shipment, let me put it this way. Yeah, the second shipment of vaccines, 7,900 doses. And those were from Moderna. And they came in, they went directly to the healthcare facilities, and they're beginning to get those doses into the arms of our healthcare workers. So for Moderna, one vial, you can give 10 people a shot in that one vial. So 7,900 came, and over 300 doses have been administered thus far. And so we're utilizing a tier approach or phase approach. I know there's a lot of question in this, and we're following the CDC protocols. So phase 1A, healthcare personnel, and that's what I've been talking about there. We're giving these shots to our doctors and nurses because they're dealing every single day with COVID positive patients. And we need them because they have the knowledge to help in the long run push back on COVID-19. So the healthcare professionals in phase 1A, the hospitals, the home health care, those that are at home taking care of patients at home, they're going to get the shots, including the patients, the elders that they're taking care of. Pharmacies, technicians, Navajo EMS, and other EMS services, public health. And there has been some that have gone to the public safety personnel, police officers, because they're on the front lines every day. And we need them on the long run because this virus is not going away anytime soon. We're probably going to have coronavirus outbreaks well into 2021. And so we need our first responders to help in the long run. So we're almost complete on phase 1A. And the next one is phase 1B. And we're going to start, remember when we do like an emergency during mud and winter conditions, things like that, we have our CHRs and PHNs. CHRs and PHNs are also in the phase 1A. But when we do an emergency, our CHRs and PHN go out to the high-risk patients, right? Because they're in the most vulnerable population category. And so we're going to be taking care of our high-risk patients. Again, this is voluntary. We're not forcing people, but there's going to be an elder campaign to talk more about these two vaccines. And if grandma, grandpa, or elders want to take the vaccine, they'll be open to that. High-risk patients. High-risk patients are the ones that are elderly or those that are in need of physicians to oversee them at home. So, and then the next group or the next grouping will be the older patients. That's 65 years and over. So there's going to be a lot of people in that category, right? 65 years and over. And so that's going to be starting January 11th, because we're going to have to do a lot of public information so our elders are informed of what the vaccines are all about. And come January 11th, those that are over 65 high-risk patients that want to do it, they'll begin to get their vaccination. Remember, you got to have 2 shots, both for Pfizer and both for Moderna. And it's critical that those that get the first shot, they got to come back for the second shot. And there's a small window that they need to come back and get their second shot. So we got to coordinate all that with our elders. And then you got the frontline essential workers, again, first responders, police officers, and rangers, correction workers, firefighters, non-emergency medical services, spiritual leaders, medicine men, roadmen, pastors, Navajo Nation leaders and employees, essential businesses, essential infrastructure, and then we go down. And for those that are in the healthy category, or those that may have already had the virus, the vaccines for the general public may not be available in bulk until March or April, is what we're hearing. But let me tell you the good news. The good news for the Indian Health Services, Navajo Department of Health, all the service unit here, areas here, you guys did a great job in getting the vaccines out. And that's why we used most of it up, 3,900. And so because of that, there's going to be already another shipment of Pfizer coming to the Navajo Nation, Pfizer shots. So this would be, let me let you know that this is going to be the 3rd delivery, right? The first delivery was Pfizer, 3,900. The second delivery of doses were Moderna, 7,900. So the third delivery will be about 2,900 Pfizer. And then we're going to also get the fourth delivery, and that will be Moderna again. So overall, we're looking at over 10,000 doses coming in Navajo Nation. And that's why January is critical, to get the information out. And then we know that, you know, the schools are still online, and teachers are wanting to also get the vaccination. And so those are going to be the tier approach, right? We got to take care of our most vulnerable population first. We've also got to take care of our first response. And we're going by what CDC has. So don't people start getting all upset about this. Nationally, this is what is being used as the protocol. And so that's very important for all of us to know. Now, if school was in session, of course, that would be different, right? But it's not. And so, but the teachers and administrators are going to be on the phase 1B in that area before, maybe early on in phase 1C. And then, of course, that's probably February or early March. And so those are what we're helping us guide us during this time for prioritization of the vaccination. So let me go a little bit to the elder campaign. Masan che nale dan linigia e kodo the nek etchebah negi ncha del netole. Sayo oyo yi yada da no da hanne kodoya askan da hilis oyo e ha ishin kha set da no da hanne akonde kon zel indan lingi e ai da kon badat. So di nakha khata ni tsana da ni akonde ni hin khasla masan situation nale nasta no lingi ni hin khasla dola nasano e don senda da don. فشي اي يكون خالتشن هيك دان لنجي خونش مسان جنال تشي نا دوتس اي غت اي دو ندوز نتا دي دكوسن سخاجي ننجي جو غت اي بانس دا كيس دو ليلشي اكون دا هنجي نكي تشكو ديل نتو دا دي يسمت اس يوش كارلونا يا لي ناكيت ألا شاطات كنا دونا كتات هنا أي شيء كده نجمسنا نكتشيني نالناس دازلينجي دي شاطات ستان زنيجي أي شيء كوا أي start date $9 $1,000 high risk patient هون نجمسنا نكتشيني نالنجي كيران زنيجي ده زل إن بعدها ليانجي يا أي شيء دو $1,000 شاكون يسنسا not lehoya ako kodo ni CH sharp daro zel endan denigi ni keda des inle eshindo el sabada $7 so di kon nashnegi kodo ni masani ki chain nala بعد هويليان دولار لو بكده ده $3 نيجي تلاقي نيجي تسيسا يادا يا أروس بدأ دول ناجي إيشين لي مارش تو أبريل جو يوش كاتلون شيء إيه بعد $6 لكو دي زيجي نيجي تكون دال إن لي واشنطن ده دويل نادا دي كويدا دميليا جنال تاو نيجي تكون دال إبني نا إيه قط هذا دي نيش تهدو ني واشنطن ده إيه واشنطن ده what hada del yagi na tsosukada yilagi eni khido what bike adel neto les kodo ni khitre ashtane da yilagi do kodo ni keni hinne bada do se hadne gi jo da yilagi kodo na tsosgi kota bike del neto les kedo shne on $1,000 biniye. So I know that there are also a lot of individuals are wondering, well, I don't know if I want to take the vaccine. Is it safe? You know, you have people like Dr. Fauci take the vaccine. A lot of the doctors, Navajo doctors throughout the Navajo Nation who have taken the vaccine last week. You saw maybe on the news, President-elect Biden taking the vaccine and many others. And people are saying, well, President Nez, when are you going to take the vaccine? You be the first, right? And people are saying, well, guinea pigs and all that. But to let everybody know that we have full confidence in our scientists out there. You know, tomorrow or Thursday, some of the leadership of the Navajo Nation, as well as the Indian Health Services, you know, we're not jumping ahead of the line. We are doing this. We're going to get vaccinated just to let our Navajo people know that we have confidence in the vaccine. And, you know, I'm healthy. I consider myself healthy. I'm a runner. I eat well. I try to eat well as much as I can. But as the leader of the nation, you have to, you know, set an example. And that's why I will volunteer to take the vaccine. And we'll do that on Thursday for the town hall meeting. We got IHS leadership that's going to be joining us. We got some council, the speaker, and some of the elder delegates that are going to get their vaccination as well. Not the entire council because of continuity of government, but just to show and to, you know, bring awareness, bring confidence to this vaccine. And we'll be doing that on Thursday. And, you know, we look forward to that. And I don't have, you know, I've got the measles, mumps, rubella when I was a kid. You know, we didn't question that. I don't think my mom ever questioned those vaccines because, you know, mom and dad didn't want us to have measles, mumps, or rubella. And so those are vaccinations that had to happen. And, you know, and then other vaccination, I think my mom's generation, you know, you can see a circle on their arm, right? That was also a vaccination. You know, there's a lot of viruses out there, from smallpox to all sorts, that there have been vaccinations on. So this is, I guess, our generation. And it's safe in the eyes of our healthcare professionals. And if there are doctors, our Navajo doctors are saying it's safe, you know, I mean, we told them to go to school and get an education and come home and help their people. And if they're saying it's safe, then, you know, I'll support it and take the vaccine just so that our Navajo people can have confidence in the vaccine. So that's going to be happening on Thursday, ladies and gentlemen. So tune in. Thursday, we'll be at Gallup Indian Medical Center to show that to our Navajo people. Thursday at 10 a.m. So tune in to that town hall meeting. And, you know, we extended our stay at home, our shelter in place to January 10th. Administrative leave, all our people that work for the nation are staying home except for essential employees. There's a lot of essential employees that are still working around the clock, you know. And so we are going to be talking a little bit more about more of our essential workers to get vaccinated as well. Not just Navajo Nation government, but you also have to look at the enterprises, you know, NTUA and NECA working on the front lines of keeping our government moving. And of course, we're going to take care of our most vulnerable population, our elders. That's important. And a lot of our elders are medicine men. A lot of our elders are pastors and spiritual leaders as well. So they'll fit into that category. So we are looking forward to the transition from 2020 to 2021. I know that everybody had a lot of hope in 2020. I know there are people that may say, well, 2020 kind of wasn't what I expected. You know, we thought 2020 was going to be a big year. People were praying that 2020 would be transformational. So in a way, right? In a way, I hate to say this, but in every difficult time, trying time, there's always a good thing. And of course, we lost over 770 of our Navajo people. Our thoughts and prayers go out to them, their families. We lost people, yes. People got the virus. But if you look at what happened these past 10 months, I'm hoping and praying that we got closer to our family members or closer to our children because they're at home. And we handed down some of our teaching to our younger generation, which they would probably have never received in a traditional school setting, right? Working hard, getting wood. I mean, man, some of us, we grew up with that, and that was the resilience teaching handed down. So in a way, 2020 put in a positive light, brought us closer together, and reminded us of what is important: family and our teaching. And as we transition to 2021, I guess a self-reflection of all of us, for all of us. What can we do better? Maybe less negativity, maybe a little bit more being helpful to people around us. And I guess it's kind of a reset for many of us, even as leaders, to look into the future, because you have to have a hope for your people. And we did our very best. Dr. Pearl Yellowman said it best. I mean, we were working around the clock, saving lives, and she's right. A lot of division directors have been on the front lines, all of them, saving lives. I mean, I think really, I hate to say, but it might have been a lot worse if we didn't put some of these very strict protocols in place. 777 of our relatives lost their lives to COVID-19, and our thoughts and prayers go out to our Navajo people. A lot more have been able to persevere and to really stay positive throughout this time. It was a very difficult time. But I know that because of this, we're going to be stronger, and we are going to be a lot more compassionate to our people. So the kudo o here na da ni ni do de. So kudo e ya so the zen kuiche be yelti. Ado di asana khayan ta ya. Di khagi 2020 biye. E ya njonago e ya kudo Nhendo da di notes di zende akonde hashitao njonago nhendo kot agi so the zinigi saado behadasi zita un njonago nhendo do yego di yin hika do wasta di no akoti kadi khagi kadnes nandes di nasnegi nkhayshni Ara fashion bands be kesto la do di khagi do dagon hije na hotio na khe di ne o ashini akonde joban tsu keso ya koni hi keni hi nan khalchin anim da khegi aha gandan da has kha kodo hanen biche kodel ya la shin hota bas kida na antine Dunle old cut the aid or hot albich yada tita. Do a hot ahnet which a kundal vita. Hagan has the a codon here or Iltonian antin. Ben that need him. Yita house sachet the hot ne. The Hagan the Nilchalchin the house tra ado Yego da iltrada. Nte. Sachet codon here or Ilton his zadon hin until which could I yield Codelia Ado Yitahos she codo yet up at zeal do le so a cotado le old cut ye kut ab do bada hanna na konde hagan da hast kan e kodon ke ol ilon ke nina antibich ko delia jeda bezil do de kuida nach go nasko khal chindo yan sada kesto de do le nashni he da hagan da nasi khane da njana go shiya ho a hagan da satta shmasan shi shnal shmado shjen kut an shi hat zi ne ya hetan zindole jo e ati niya kodo be hande tso oyo hashkejin hit yada tiasa ni yada ho a ndishni e kadi be dan hit zil nas da sitlin kadbe kodo be hetan danitsen njuna go shi ha ho zila winzen kadnastele shmasan shi shnal kodo shi ha ze e be shi zil kodona halchin ani da kregi ahot ayan da kesto le nastasne so kodo ban da kes nihit so de zene bet so de zene ahot za din kha ida kaden hikain hidna bil ayede go bil yadel tio indasikli tlai on de nation nash a ede ban de kesende a konde dinasnegi oyo jogo inna lago ahot ahranas ade jo that ni tin dasikli so do di khagi bede to le di 2021 bi na khagi hait aban de kesto di ze bahzli jukon bayashti ze bahzli do kon hikeni nashi bada tsdode dinasnegi bitsadode ado de nesheshi akonanet edode la konde di khagi 2020 biyegi bedeli dole finason ednece kon hikeni nasa diyeni enda aste akonde bedeli ako kon hikeni nasa bedadol na di kusin tsraina hast etsata diche das kre biche das si kre da di ni dole ich keda na antinan lewel de gona aste biche ni kredo are na il dekat di ne ni kliniki kagish kiji dan linigi di Stadin Hautzon, Johnny Hitch, that is Navajo Nation da no. Bini Nagi Johnny Kuni Kane, he many Masan, he chain another, Kida Nahada Yila, Ek at bet, than he hit Zildiche. Kajan hint go Kodo Naso, Badate, $8. So Kenny another cat. Ato da Chigi a badate. Added than he nash on $8 the ne di nashlihe da to kosen tskhagi nast da nashlihe da dolato the nat ari do bezel in do salad the ken da zon hot a da is tsa yichin khe nashligi dan hisni dole the ena antine nasko del neto le shkiroshin so could the neck catcher could only get anana seat or there's double the Ghana catcher. Aro she had and he need or there's the agenda national name and Georgia Zelins and Asian Concha Conde Credole. Shadosha set or there's the Zegi Beninagi a ya aro bindal to the snow what are a Kudosha dot setting. Chiti Zel in the Linigi Jego. Da ich tragin khalchin de nedan lenigi go di zel in dan lenigi kat di ken da zido shido shado tsetan zo la ba da tsgode jon hier da di ne da ino khato tso in dan khandi da ton hi khandi was kade ya hot asa zel in dan lenigi de nedan lenigi kon daznish Edo dan aro bindal so that the zegi ebinina ishido kodo nakha cha dots aro bindal so the to she large not ani dasho sado shinado vice president living ebinina large zigo, but over cave with the napa, la na jinsano, a hush doni, and so answers kiss. So, Dinjin that Nashona, Nes now is Kilo Binagoshi and the Kado Lestido, Kodo, Banagi Shido, Ad Hija, the Huiznet or the Shkiroshina. So, Consortium Hija, Sido, Lesto, Kodoshi, a ya, doctors, Captain Brian Johnson, which economic left. Captain Johnson, I'll turn the time over to you, the Indian Health Services. Thank you so much, everybody. God bless you, and God bless our great Navajo Nation. Yeah.
Thank you, President Nez. We certainly appreciate the time, and thank you for the opportunity to speak with our audience on Facebook Live. I would have my photo up on the Facebook page, however, to save bandwidth, we've had some issues with that. So I'll just keep my name on the screen. But again, thank you for the opportunity. Some of the information that I'll share will also touch on many of the things that President Nez has mentioned. And personally, I like to take a step back at times just to make sure that we're all on the same page in terms of understanding of what's going on and how we're moving forward in this time of the pandemic. And I just want to reassure everyone with Navajo Area Indian Health Service, which I serve as the acting deputy area director. I work beside Ms. Rosalind So. And on a daily basis, of course, we've all worked extremely long days and continue to fight the good fight against this virus, and doing our very best to make sure that the Navajo people locally and regionally are taken care of to the best of our abilities. Just wanted to make a few comments about our service unit operations. Talk just a little bit about the vaccines. Again, of course, the vaccines are an area that's of interest to everyone these days, of course. Just a little bit on the priorities in terms of vaccine priorities. A little bit of information as well on our work with the Veterans Administration, and then a comment or two on funding for the Indian Health Service. And so I'll just start off by mentioning that we continue across the Navajo area. If one looks from a bird's eye view over the Navajo Nation, of course, there are both federal healthcare facilities and tribally authorized. Navajo Nation has authorized tribal healthcare facilities to operate, of course, on the Navajo Nation as well. And I just wanted to reassure the folks out there that the partnerships and collaboration continues as it has from the very beginning of this pandemic. We all do participate with the Navajo Nation Health Command Operations Center, and there are many of us who join each morning, each workday morning. We do participate in what's referred to as the Unified Coordination Group. And that particular meeting, it does include leaders in the healthcare fields, and as well as in the federal programs, with Dr. Jill Jim leading that. We also have the BIA, IHS, some of the state programs are on, some of the leaders there. President Nez and others also join. So it's a time each morning to take a few minutes to just help each other understand where we're at, what we're working on, and how we're going to move forward in a collaborative way. So I think that's been extremely important, because if we do not have a centralized approach to the pandemic, then many things might be missed. And I think the communications in that with the Health Command Operations Center has been very helpful through what we refer to as the UCG. So we appreciate that continued collaboration. So for those out there who may not, work in the area of healthcare, or maybe have a real solid understanding of how healthcare works, during a pandemic of this nature, it's really important when we have those UCG meetings to take a moment to make sure that we understand just how full our healthcare facilities are, whether we're talking about the Northern Navajo Medical Center in Shiprock, or the Gallup Indian Medical Center in Gallup, or if we're talking about our tribal partners out at Tuba City and Winslow and Fort Defiance. It's important that we all have an understanding of where we stand in terms of patient care, making sure that we have the capacity, the beds that are available. If a family member needs a bed because they're feeling ill and they're dealing with COVID, we want to make sure that we can take care of any member here in the Navajo area to make sure that folks are taken care of appropriately. So every morning we talk about bed capacity, hospital beds. Are they open? Do we have intensive care unit beds? Do we have other types of beds throughout the facility that we can, again, provide adequate health care? And that information is shared across. And so, again, if we did not have that collaboration, that type of communication, it would be very, very difficult, even more so difficult making it through this pandemic. So again, we're thankful for that. Other things we talk about, and I know many people out there have heard the terminology PPE, or it's all referred to as personal protective equipment. And so for all of our healthcare professionals across the Navajo area, whether you're working on the front lines as a healthcare provider, or whether you're a housekeeper, all positions are important at this time in this pandemic. And it's very critical that our hospitals be cleaned appropriately and sanitized to receive patients and visitors in a very safe manner. So it's important, therefore, that we make sure that PPEs are available. And that includes the respirators, it includes the gloves, it includes certain types of gowns that we use in healthcare. All of that are critical items that each day that we utilize. And so by, again, having our central communications there at the Health Command, we're able to make sure that if supplies are getting short, or if we need to order, or if we need to help each other out, then those types of conversations take place as well. And as a Navajo Nation resident, as a member of the Navajo Nation out there, you should be proud of the communications that are going back and forth between the healthcare facilities, because it is critical that happen, and it happen seamlessly. The other thing I'll touch on with our healthcare facilities is, I've mentioned in the past that we do have deployed personnel that have come in to the Navajo area from outside. So maybe they come from New Jersey or Florida or Kansas. We have visitors here that are assisting with healthcare to help further support the healthcare providers that we have at each of our facilities. Again, a pandemic of this nature is not something, again, we're all accustomed to. And so the long hours, the number of months that this has transpired, it's very, very important that we do have that support and that backup to help make sure that we have appropriate coverage and that people are getting adequate rest so that we can make good decisions in the course of providing care. So we do continue to have individuals with the Department of Defense. Some of them are with the U.S. Navy, for example, at Shiprock and at Chinle Comprehensive Healthcare Facility. Those are teams that are from the Navy, and they have critical care nurses with them that have been providing care for over a week now. And we certainly appreciate them providing that care. These are highly trained, highly skilled individuals who are really, really happy to be here working with the Navajo Nation. So we're ecstatic about that. There's also other deployed individuals with the U.S. Public Health Service, and many folks on this Facebook may be quite familiar with commissioned officers that we already have on the Navajo Nation. For example, myself, I'm a commissioned officer, worked on the Navajo Nation since 2005. I've been stationed here in various capacities, and that's my permanent position. Whereas we've brought in others that are coming from outside, and they're with the Public Health Service. And again, some of them are working here 30 days, 45 days, whatever is needed to support, along with the Department of Defense, the U.S. Navy, and also we also have some U.S. Army folks here as well. So I've been very pleased with the coordination that has taken place. Oftentimes, when you have individuals come in from outside, it can be quite a change of workflow. But really, the work, the collaboration, the partnerships, and integrating into the Indian Health Service facility has been really, really good. And we continue to look forward to that continued partnership. So the next thing I'll just touch on real briefly is we talked, President Nez really covered nicely this morning the situation with the vaccines. And from a high level, I just wanted to mention that, nationally, we know that 2 vaccines have received emergency use authorization, which include both the Pfizer and the Moderna vaccines. And this was talked about pretty extensively earlier with President Nez's presentation, so I won't go into great detail. But we know that we had excellent distribution within, with the Indian Health Service and the Emergency Operations Center working diligently and planning. The delivery went very well, the initial delivery with Pfizer vaccine. And since that time, Moderna vaccine has been shipped directly to the healthcare facilities. And so someone may ask, well, did we receive enough for everyone at this point? Not at this juncture, as President Nez indicated. There are different phases of the vaccine. The vaccine is being produced, and as adequate amounts are produced, they're being shipped around the country, whether we're talking about the Navajo Nation or whether we're talking about a large hospital in New York City. That vaccine is being produced and shipped out as equitably as possible. But, nationally, it is well known the impact that has taken place here on the Navajo Nation. And that is being taken very seriously. And so we do feel at this point that in terms of receiving vaccine, that we're in a good place to make sure we are getting those initial vaccinations completed, and that we can move down the phased list of vaccinations as orderly as possible, and making sure that we're taking care of our population. So I won't go into any more detail than that, but just to reassure that, we have now received over 21,000 doses of vaccine between the Pfizer and the Moderna deliveries. So that's a huge thing for the Navajo people, and we look forward to continuing that work. One of the other things that I wanted to touch on just briefly is I've mentioned before in previous Facebook sessions that the Indian Health Service has enjoyed a partnership with the Veterans Administration. And I know the Navajo Nation has a proud history of individuals serving in the U.S. military. And I know that we have a number of folks across the Navajo area, Navajo Nation, who do have Veterans Administration benefits and complement their Indian Health Service benefits with their Veterans Administration benefits. But we have worked together as two federal entities, Indian Health Service and Veterans Administration, on this pandemic response. And specifically, what we've been able to do is, between both of our agencies, come to agreement that the Veterans Administration can provide some support through their medical centers for both veterans and non-veterans during this COVID pandemic. And what this has led to is, for example, Gallup Indian Medical Center is able to work with the VA Medical Center in Albuquerque, New Mexico, to transfer patients when needed. If we have a patient with a serious condition and they need a higher level of care, we're able to ship directly, transfer the patient to the VA, and there's a very orderly process in doing that. And it assures that we maintain bed availability in the event that we're getting full locally, which we have encountered over the last 2-3 months. We have seen that not only Albuquerque and not only here on the nation, but also down in Phoenix and other locations, some of the private hospitals have become full. And so in those times, we were able to work with the Veterans Administration to make sure that we have a bed space for those of our patients who may need that. So in a similar fashion, Chin Lee Comprehensive Healthcare Facility also has that outlet as a way also of transferring patients to Tucson and to Phoenix. And again, these relationships and this process is working well when needed. And it's just nice to know that it's there and that we can have very, very top, very excellent care when needed for our patient population. And I also just wanted to mention that Ms. So and I had a conversation just yesterday with the VA administrators in Salt Lake City as well as Grand Junction, Colorado, where we are coming to an agreement as well for the Northern Navajo Medical Center as well to refer patients, transfer patients when needed. Again, this is another step forward in just making sure that we're doing everything we can to make sure we have the highest quality care for our patients locally. So it's exciting to know that we're working together in that way. The last bullet that I'll just mention real quick is I'm happy to report, and I know most people interested in the topic have already heard, but just recently the Indian Health Service was notified, of course, that Congress did pass a 2021 budget for the Indian Health Service. And this is critical during this stage of the pandemic, that in some cases we can run into situations where a budget does not get approved, or maybe continuing resolutions continue for a while. But we're just very fortunate that we did get a fiscal year 2021 budget appropriation, which also includes additional COVID-19 supplemental funding. And when I talk about that funding, that not only helps the federal IHS facilities, but it helps it supports the Navajo Nation tribally managed facilities, again, such as Tuba City and Winslow and Fort Defiance, and also supports the Navajo Nation with some of their its health programs. So we're very excited that that was passed over the weekend. And we just look forward to continuing our work together. So in just a final closing statement, I always take time I just want to thank the Navajo Nation leadership, President Nez, Vice President Leiser. I want to thank Speaker Damon and the delegates out there who have really helped and has been so interested in doing what they can to help the Navajo people. It has made our jobs a lot easier. by having that input and that interest in looking out for the Navajo people. And I also always take time to thank those the healthcare workers out there. Earlier, I mentioned the housekeepers, and I just want to give a shout out to the housekeepers across the Navajo area working in the various types of facilities, because without them, our facilities would not be sanitized, they would not be cleaned appropriately, and just really taking care of our facilities in general. And of course, with facilities engineers and with nurses and doctors, with infection control practitioners and administrators. There's various levels of administrators. It takes a team. Healthcare can be very complicated. It takes a team to approach this as we have. And I just want to thank everyone out there for their dedication and commitment for all of these months. But with that said, I'm going to stop there, and I'm going to turn the time over to Dr. Fowler, who will do some translation of what I just commented on, and then the time will be turned to Dr. And so we'll turn it over now. Thank you.
Thank you, Brian. Brian Johnson in Nido, Nido, Le Hashin, Sogokadon, his Chinahash, Ado the area office will yet Aj, not only Lini Kenas, Honey Aj, a large, the Sataro Aj, a large, Satosha Hodni, Okati, Zail, Imbasnas, Ano a Yego, the Nan Lini, Bahani, Zendo, up to cut a nail, Oko Aj, yes. Nihina Nishil, Aquadon Lake Nahal Peso be a car yedido upon Zel Embasnahas Ani Church Juno is his days Nish do a car has been to go a Sunday leto Bebe Hadates Adoti have command center, but Nini should Ajit that the whole Ishigi Ajito Juno, but they need niche. Ako adon lepia that tolia ado kinake was kodeta ado an hinat ani dan lini benahat ado be or instit hashine la bayang de ti ako hin bayate tito halet kwatenen lini bekanat o wasi Allah in sako nihinanish ido Halan hidden and Lini Ebacat or Watoya at Ehonana Tado, Ado di Tasketo, Hashin Saga Aquija Eba Banta Wheel Neto Benahuitaha, the Anahas Ado di Code and Handa Nishidan Lini di PPE de Nini is the Neka Argent that Nishi A. Papa inis the doba at kitten date na anle ya annis the art up and yes a natle. I don't lead the yen that the heat at all. Check the razita a chin is that there's palita, but on snap at or no snella that the no the a large bentahuit. I don't know, couldn't 80 as his days nishodo. Do as his tahuis now I seen hit the nan lini pitchet na hui na do le ebini na quit home but Sunday le do papa na hui ta I don't know couldn't yadi deployed personnel is na hashin sago but see tiji dan le ado belakana as and he can't that oh you hashin la aquanta nishe chetes credo dan na kwasa the task do nishi paholnodo hashin sago later last so that then other do hashin sago is a neka is a in the dan lini other quad o you hika not jahot ado hashin la cutting ado this they no la chinta nata nish the last so dan lini army de na adon navy aden she could the house kego saton he can't touch ado saton ni hisen da adon juno is hisen business adon na ya na skedi is the destiny ki to hashin so could Saknahan ni koto hinat anin lini shana yahat zi ti sa Pfizer walya ado Moderna ako ado ze kwaad the nabasahot sa bakha hashin sa go ata tati Israel inakontas ni kwati inni Moderna walya ni ke ande Israel ibatnas ano ad betrohalya ado na kunay is additional ka to kwa at sapeha at sekto kwa jono tato nito and lake nahal kede to dan ade tish latin ka hot so de aita yeta anni hashin so ko kwade nikito is the virus or any the cosn sanas it's at the bebet or jini koden hans ni aita the husband a cook at this change Natino asa the media upon lie is the aita chios ido sa shake at the is the lini it's ispa at the Adana Kunati to last so Aja Veterans Administration with Yedo is the Emitnahas Anna Edo Yat El Histate Nisto Hashin Togo Nahuit Ado Nabik Edi Hajo Edi and hit to last so the ne Twisani to educate and Lini to last so and Lini Aja Hajo Ba Akayado left at the no Ehut Ba Aquilia. Kala edi talat so the cousin sabit betol na ado yabit na hoy nanadin le kin has ago compass atad na hashin to go ket no ta do ande tisk as ando talat so do aja alalaj ba ade now inils and edi na Georgia because aja le Albuquerque ado dichin lige le host the ado ka need a tana benya sasi kligi ya so le ka hot Georgia ajdo hashin so godina tani ned zail and ajdo pa salat so ba ati khato ba ye ado kedo be yet be hazo ze di peso ni kinahal kede be la azli edo ban hilta hajja 2021 budget आज चलते ना आनी दन लिनी किनार के ये लता असली अको पैसो बिन यही गेती इज़ेल इबस नहस आगो स्मती दनबस का होज़ो ऐशी आज पे एट ओ वस निहित नपा आदो ना खुने खेती के इके हैस्टी नी आदो दी चलते ना आनी नफलनी लाज सुताई खेदो ता सुताई आदो Nihil speaker lini ado besh mahasa ana ad here nihilne ado naskochi ad hilne nistole ado zen agent dal nishido ntaha shohido ataha sani nihido yegon tsago here o wana yu ado zende edo here hashin so pa nihide nabaka o wadi ba here sin hot ya but now wish na ole ashay khodo Dr. Jim Bernard Dr. Jim
Yeah, non Dr. Fowler, Shay Dr. Jill Jimmy Seattle, Executive Director for Navajo Department of Health. Do dona en shone look on shon touching passes chain do a shane do shiche do zafan a do shanella. Do kaet ispa hayane big attention do the adesne argue kaedi all COVID-19 update especially do the public health messaging on yaniti especially they had test other Dyson Dyson argue also hand getting need on non kaedi Ashi Christian kaedi the at the me said do at the think she is do din his that do in his chin ka but that is for the big escape but so yes do or what are Christian in das nation do Hawan that the header he visited the Hanon the either the chin of the big escape do ya at eto kingon da kego da sto the chin do the the Navajo Nation, the caught gay quite the general quite the adult and the quite at the we're really good at following directions on wearing our mask and with Ashin Day. Also, the social day quite the the husband. Although it's on the dark and the quite the 6 feet distance from the need off with all the and so. Kun na nation da don lake can go down Auden da kigota. So maintaining your 6 feet of physical distance at work or at grocery stores or in convenience stores are still very important. Although nila contact is still 20 seconds quite it's not still. With the washing your hands is very important still. To make sure that you're washing off all your germs, whatever you touch. Try not to touch your eyes or your mouth with dirty hands or anything. So before you eat, wash your hands. So those are very important as germs will sit on your hand. You want to make sure you don't transmit any germs into whatever you're going to put in your mouth or making sure you don't rub your eyes as well. Although I wonder that and so although chidibiyet so what up and that so although the high touch surface areas that so the quite remote control door and the best behind that any door refrigerator door that any door knobs and what that any quick jumping clean that also yeah it's also maintaining your cleaning, disinfecting, not only at home, but inside your vehicle, at work, are also very important messages. And then the washing your hands part, I always encourage everyone to make sure they wash their hands correctly by making sure you wet your hands with water completely, making sure you apply enough soap to cover all your hand surfaces, rub your hands together and scrub everywhere on your hand. Rinse hands with water and then dry completely. Adon hila contact isoge di and hila the tail art contact in copeto ado quality soap. Make sure there's soap that covers your entire hand. Quality color was it hila ponka quality if you hundas in kodo adon hila kahanta don hila soto hila the cot the do ado on your palm that any kado what asking in her chin the quality get the horse ato yat eto do asking untouched nana do other adon general quite a lot candy kiss so want to get the horse ato the lot Sunday is the other she on also quite the better husband on fashion what are she so at echo other quite make sure you rinse your hands with water other casual the air dry or other paper towel bags or dry and fashion so at echo other days at the question charging now state other the Isabels and the quality exposure, the non-exposure, the close contact, the non-quality, the then go ahead, the CDC, the any quality, the on down with what the quality, the better husband, Shinto, the incubation period, the 14 days, the quality. The question talking now states at the party about a kunza or inta at Kahaniki. Even not the Kaedi Jane Hungani Hatata, what they draw that, what they draw down the job and the said head of the Kahaniko. Other the Oshiti Kaedi, Deshi Kaedi, the incubation period Hungani it takes up to 14 days, although the Jane A. She went to a holiday party with people she doesn't live with, and she has been waiting all year for this event and chooses to go to see people she has not seen for almost a year. So, she Jane is exposed at the holiday party. She is linked to Konazia. She met up with her friends. So on day 3, she learns she was exposed and self-isolates at home. The AB holiday party that's the heda that's the Kahaniga, although that they might have tested positive with Ashi Bethada's and so they tell Jane that you've been exposed. Although Hawagon Nasaka isolated the when when the individual is isolating, make sure they do it properly, cleaning up after each other, wearing a mask indoors if others live in the household. So isolation a hotel on the Navajo Nation. They're in Farmington and Tuba City and Chinle. You can stay over there and make sure you get monitored if you can't self-isolate at home. Ako Jane and they home gon nasala gon is now Jane gets tested for COVID-19. Crashing well up is good the got that so all crashing now is indigo cause she got tested. On day 6, 2 days my kitchen is neat. We're assuming that Jane is still self-isolating, right? That's what the Chicago class self-isolated. Jane tests results come back negative. Okay. Negative so she on day 8 na cannot kitchen link on day 8 she thinks she doesn't have COVID. So she did not done so she goes holiday shopping and visits family members and friends. Cause she goes out in public and maybe she doesn't wear a mask or maybe she does, but Jane doesn't know that she does have COVID-19 and is contagious even without symptoms. So I believe asymptomatic data. She I thought the best not go and the double thousand. A question there's not quite the nation visit ye lado crashing the friends of the family members big Asian what's although holiday shopping in ye lado there's not as well in the quality but Jane although she the course of that she finally decides to get tested again and then finally tests positive for COVID-19. There's not as well in the incubation period it's different for each person. I've been nothing quite the where you visit people that any I bet that's instead the husband she got the incubation period. So head up at the hasnet though, you got not skin though. I share with other yards echo. And then shopping for essential during the 3-day weekend lockdown being not there's gonna be 2 additional lockdowns as we continue to see a lot of numbers. So also I go quite the kikona kedo and the errands about had for and what 10% to go to the grocery stores, it's recommended that only one person of the household should be leaving the home to shop or do errands as well. So with all that, the safest places at home. So when the dicey tango she day at eto even though we have some hope here with the vaccine, though they go not adult kids that masandon the chase but not the need so yeah, Dyson was arguing, I'm going to hand over the time to Dr. Ba. Her and her team, they do a lot of work with the daily numbers. I appreciate all the work that they do, and I hope they took their time off the last couple of days to rejuvenate and continue to do the work that they love to do and epidemiology. So Dr. Va, go ahead. Thank you.
Hi, good morning, everybody, and thank you so much, Dr. Jim, for that introduction. And I will be presenting this with Dr. Fowler, and so I'm going to say thank you so much to Dr. Fowler for assisting with communicating our important message to the team and to the people out there on Facebook this morning. Let me go ahead and share my screen, and I will start presenting now. And so these are, our unified, Navajo Nation Unified Epidemiology team looks at this data week to week, and we present it in 2-week periods, but we do look at this week to week, day to day, and these are our gating indicators. And so we will talk about cases, testing, hospital capacity, and public health capacity, and then give an idea of where we are, where we think we may be heading. The first measure that we will discuss are cases. And so the first thing I want to show you is what we call our epi curve. What that means is that we track the number of cases by day since the beginning of this outbreak. So essentially since March 1st. And what you see here is this line, this curve represents the number of cases by day that we have experienced here in Navajo Nation. We had our first surge, and you see that rise in cases in March, April, May, and then the second rise here, increase in cases, had started since Labor Day. And now what I will do is I will zoom in closer. This graph only shows you the second surge in cases, which started since Labor Day. So this starts since September 1st. And what we do know from this graph is that there was a shelter-in-place order placed mid-November, November 16th. And then since then, we saw the cases rise slightly and then what we call flatten out. It started to flatten out and slow down. And there may be some signal or some indication that we might be seeing it go down. This is dependent on a few other things, such as we do not see the impact of Christmas and the holiday season just yet, and we are anticipating that. And so we know that we have indeed flattened down, maybe some indication of going down even, but the impact of the holiday season is yet to come. Dr. Fowler?
Ya nanit eşik edoşne ete tatrba hashin saka aje na alka walieni aje hajil soy ketez in akoti ya nanal kahiti ti zli latata hios karton le natino atije akol sede na khanshni eta eti woshti gizleta ada oyo ta hotzan le atchil gizl konne Adoshte na hote shish edi na kiona oyon hitata hananat za edi ya ita nish ose yizilguna astata yos kafle da edi shelter in place will ya what the soldado dan hiti nene da ade hol jizo hashin tsuga ya got na des kid he hiti nido les yan des kid kat Ashon yago nanal kis akwande di keshmishta azli do wishte kat di jibi ahope bis nahana eshe ati nanal ka akwa ayay ada tsishon ayay kisto lesne Dr. Ba?
Thank you, Dr. Fowler. And so this was presented earlier by President Nez. And two take-home points here are this. The orange curve here is the Navajo Nation, and then the blue curve here is the United States. And what we do know in terms of patterns is that, again, we saw our first rise in cases in March, April, May. And then we saw our second rise after Labor Day. For the United States, they had 3 what we would call an increase in case. They saw their first few cases and an increase in March, and then they did see a bump after Memorial's Day. And then another difference here is here. If you're looking at Thanksgiving, the Navajo Nation after Thanksgiving, we were anticipating a bump from Thanksgiving. Fortunately, we did not see that. With the United States, they did. Soon after Thanksgiving, the blue curve here starts to go back up. And they did indeed see a bump. For both, we are anticipating and waiting this week and the week after to see the full impact of Christmas. And I'm hoping here in the Navajo Nation, we were able to avert that. Dr. Fowler?
Ti kwa nane kaige ani do hinat ani yana hasne akoti setsogi kon setsol ani kidigi en hidi de nebesha hotzoja aji ya hasne ako adoti to jiki be itzogi istla statino asa hotzonigi aji ya nahasne akoti tajita gasa ta hashin sago oyo Nihijit the Nabelhahozo o ya ani. Adon de did a slatino of the Labelhaho, Nikelhahozo, Aj ebita the Hotza. A quadik, a keshmish beat the he be cutty credo, Aj e Yahanani de dash a hate edo le ati ya ani so de a chinoye yananas hit that about.
And so we do see that there might be a signal of, we know that there's definitely a signal of slowing down and flattening the curve. We think there might be a signal of a decrease in cases, but we're going to hold off and observe to see what happens after Christmas and New Year's. Our next slides here, we'll look at what about the burden of cases, meaning yes, we are in this surge, the second surge, but what about the burden and the impact of those cases here for Navajo Nation, given our population? And so what we do understand is that these two numbers represent two things. The first number, 109 average daily cases for our population over the last 14 days ending on Christmas Eve was 109. Now, over the last 7 days of that period, ending on Christmas Eve, it was 99. And so that number going down tells us for our population, it's slowing down. But notice that by the 8 federal and service areas, you see that the colors are still red and purple. And that means that for our population, even though we know we are slowing down, that burden in cases still remains high. Dr. Fowler?
Di kwa ya yasti ike ani ya ani en hiltahosen a quando di petatel na ike hashin sagoto sapetatel na da a quando di kashmish is lido bekedo atito ya hanahin data shi yispe behosen dole ado di asad nezatino anast beta na ya atsan le tikit tit atachin ado sachiya na tsaike nas etuna anast ya tosich bes ko ani ya ne ya ko ani chikedo shne akwande di khoje ni his khahozo de na bes khahozo ki aje atish chi do oyu tak yekadot ish ako ajit aho saho anne ta akon atenal kinde khod ta konal kinden his kaho zoj akonde betates na ya ani to edi kashmish be kedo nas kaishi eye go bebe hozendo le Dr. Ba.
And so as a result, what you see here is that we do compare ourselves to the 50 states in the US as well as its jurisdictions. And for 2 weeks in a row, we have remained second highest in the number of new cases for our population, second to Tennessee. And again, what that means is that our population is smaller than the other states, and so the impact of each of our cases is much higher. Dr. Fowler?
Di kwaya had ne di slatin kahod zoja aj ek adna kitamo is lini alalaj e kaha oko aj e ajashi to laani e nante oyo taton hitane kit akwande jo e ya endon nil e nitsen akwadi to jen ot abenal kai e kwa nanes ka tataba.
And so the last concept here is, has transmission slowed down? And when I talked about earlier that we were seeing that we were indeed flattening the curve, we're hoping that we really are turning the corner and starting to go down in cases. What we report also is what we call a doubling time, how fast transmission of COVID-19 happens. Into our second wave at the very beginning, this outbreak was doubling in size every 7 to 8 days, which is fast. And what you see here now, though, look at week 48, 40, all the way to week 52 last week, is that the number gets bigger and bigger and bigger. And now it's taking about a month and a half to double in size. So we do know that we are indeed slowing down. Dr. Fowler?
Di kwaya had ne igi e da ash ani ya ani ne. Akwadinas kaigi enle destina se pido destina anaste yizkonne jo the more na atle hi ek hoyostra ako ani kojo doubling time is nenigi ek da goiski ako kojigi na alkaige ani ya ani go ela janila tataba.
And then next we want to talk about testing. And so the purpose of looking at this is that we want to make sure that anybody here in Navajo Nation that's concerned about being exposed or are having symptoms or just concerned overall whether or not they have COVID-19, they have the ability to get it easily and it's accessible to them. And so this percent positivity means of all the tests done over a 7-day period, what percent of those tests come back positive? Right now, 1 in 5 or 22% come back positive. What we would like to see is we would like to see that go down. Our next goal would be to be less than 10%. And so we want to see this start to go down as our number of cases go down. Dr. Fowler?
Di kwaya yananas ke di jodi de kwasna anas es ata pedini nasni aye go skinso etates na it ako to shto na no zi it eda shikedo shit na ako di ne kai ki e asa pesa be wol tana dino a di jo e kwa es kid ako di to jinja ako has tajo kaha Asha Ecuador na to e hashil to go sa nash os na ye go skilo da ani akwande katinas kaige isla ikaho asha ebedos na ot aye yos ka akwande asha peso bewol tai asha adot is jo kunza go e yago oton nis e nitsen jo ot a bansi kes e na kwa e ot aya hodne. Dr. Ba?
And next, I'll talk about hospital capacity. And we've been hearing this on the news a lot because it's a huge concern because it goes beyond what happens now is that impact of COVID-19 goes beyond COVID-19 and starts to impact everybody else who needs hospital care. So here in Navajo Nation, if we're just looking at those that are sickest that need ICU level care, we do see that for Navajo Nation combined, our ICU staff beds used have gone beyond 80%. And so this is when it really starts to stress the system. And it means that beds that are available to treat our sickest are getting full. And it doesn't matter if it's COVID-19 or if it's any other condition. And so for all of Navajo Nation, it is getting beyond 80%. For the other 4 states, what we do see is that notice that Arizona, compared to the other states, have seen an increase in hospitalizations total over the last month to 2 months. New Mexico, Colorado, Utah are starting to see like it's slowing down and going down, but Arizona is going in the opposite direction in regards to hospitalizations for their population. That may impact us as well, as Captain Johnson was saying. And so if we're just looking specifically at their ICU bed capacity, you do see that New Mexico, Colorado, Utah, and Arizona hover around, between 75 to 80% full, if not higher. And so our ability to transfer our sickest individuals will be stressed as well. And I know that IHS facilities and tribal health organizations are working really hard to make sure that those that really need care are able to get the care they deserve. Dr. Fowler?
Akodi task Israel the task as na raj aj hashin saka khatat epi the kosental nas et at to betos na ide it eda hashin saka shin sat ni den lini betis which enda has ben that on nesta that ehiki ed task and lini apo o akon le asape so beol tra te bedien dat is belaho adelia akon the yo trojedo soledo Colorado AGG ya anni akonde hos doje yego ati tegoil kis akodi aj etas and lini do bahas ada sa da bedona aj besit od ni no do bahas ada aj khatat epi akonde di Hayda Kojipetol na hobet it or ni hajo da Bahaya the hot or needy aye gunan ado a quante pante tido the biki hot aha late up or was he hot by at hit. Dr. Ba?
And lastly, I'm going to talk about public health capacity and our ability to do contact tracing. And so right now, the Navajo Nation, with all of its partners, have been working really hard to increase the staff for contact tracing. It has gone up to 447, but we are aiming for 3 or more contact tracers for every daily new case. And so we know that this is somewhere that we are trying really hard to increase our staffing. What this means is that a contact tracer, what it means to everybody out there is that if you test positive, public health calls you and lets you know and then provides appropriate guidance for isolation. If you were exposed to someone that tested positive, we call you within 24 hours to 48 hours to notify you that you had an exposure and then what you need to do to protect yourself and to your family. And that's the role of contact tracing, is to help notify those that need to be notified so that we protect you, your family, and your community, and we continue to slow the spread of COVID-19. Dr. Fowler?
Di kwaad nakaachine tilkeji dan lini tuisani da kahigi hashin so di the kosantanas da bedol na in da alkaiti the neza dina atis dina at so akone la in da alka ako asla bedel na ana ki agent oska to ajtina ki ge da hoto list oyo ya anishinte Tato lesnte kade ana ki aj o hotel na o konte hotel na ha hashin so is in linie and hiti pa ho wat sunta da hotel ni ado di hotel na otate na tina ati is ki aj was hotel ne do na la hotel ni a jato hotel na on na hat is kan es sa ho wat to sta go yat a koti agent as kai ot ai Ye nakakahon sa nibini na kajoso ta isolation yisne. Dr. Ba?
So overall, in summary, we still remain at phase 0. There are signs of improvement thanks to everybody's efforts on the ground in the community, our healthcare workers and our essential workers. But we remain at phase 0 and stay vigilant. In addition to that, we will continue with contact tracing and vaccination efforts. But how does this compare to the rest of the Four Corners in the US? And so now I'm going to give you a snapshot of what's happening around us. First of all, this is where we are, is that we know, with the exception of Arizona, we know that Colorado, New Mexico, Utah, and Navajo Nation is going down in cases. We also know that for our population, Navajo Nation still remains the highest of the five, or the four in comparison to the 4 states. And then lastly, I will talk about what this is, this measure of infection rate. Dr. Fowler?
Yananas Kedi, Kekwana art, Ketsunile as the Asa is the Honda, Face Zero is not at the Honda Ayika. A call a hair, Nisnaha Shinsakati ya Anni, Siki, a Jashi ya Anni, Sinte. Etta Aquasiado, Nahago, Etta Hanafsendo, it Kesaton E. A koti contact tracing that kai anta il kato ado is the iki is to a day either. A koti quite name nane kidiki edi neither bakwil ne was the jet at the taguil kiss. Your torch door so late or din hit the nebeska so do color RGK ya ani. Upon the deep quiet, not as the hoist subway, not as the infection rate is not any hydro at the oil at the goes skilo. It is not easy a quiet yes hit. Dr. Ba?
And this is just a brief introduction. So what this means, this infection rate, this RT that you'll hear me and our team talk about, is this. Is that what is the ability of one person with COVID-19? What is their ability to transmit COVID-19 to how many others? So for example, if the RT is 2, it means that one person who's sick can effectively transmit disease to 2 other people. And those 2 other people will transmit disease to 4 other people. If it's greater than 1, then that transmission is fast. Things that help control that to make it less than 1 is contact tracing, isolation, quarantine, vaccinating, or vaccination. If we are effective in our public health response with all of those things, then you'll see this number get smaller and smaller to become less than 1. Navajo Nation's RT is currently less than 1.93. And it means that one person transmits COVID-19 to less than 1 person. And so that helps us understand that we are indeed slowing down because of contact tracing, effective isolation, quarantine, and now with our vaccination rollout. Dr. Fowler?
The quiet has naiki, she edo should na, Jobik et otki. The asa at zini asa betos na. Din le se cheek on us, passy a Satan nana tasia has na a quad. Dito Jijilon, what was na a hastaj on skislo, but it was na he it a quad. Die skislo ya anni, ya ya anni, the schne a quad di. Bayel ho one na has ago asa ani hit a yana hasot. Satan nana tasi satan was ya ira and tatato was a quadi asa as zini ya has ne asa at zon hotolna and le has tant etablish that osna eslalt eta ado satahashi nana ta ade but hanani the only na kita tako is ke ye go ba ko tia ko tipe has ani hatatel na a public health order de nini a big ahonos any hisna. Dr. Ba?
And as we move forward, we know that the burden is high. Notice the dark severe outbreak in California, Arizona, and we know the burden has been high here, whether it's in cases, hospitalization, and even in death. And so, I do know that the will of the people are being tested, but as we look around us, we see that that is indeed happening across the United States. We can look at this by counties, and you can see the same thing across Southern California, almost all of Arizona, and especially the counties here in Navajo Nation. But I want to take this time to thank everybody for the efforts that's happening right now in this response, whether you are a healthcare worker, first line worker, essential worker who works at Bashas, or you are just a community member trying to do your best, is that we are seeing indications that what we are doing, multiple things, are working. And I'm hoping that the ability to alleviate some of that burden will start to show soon over the next few months. And so I do ask for your vigilance, but I also want to thank you for your contribution to all of this. Dr. Fowler?
Thank you, Dr. Va. Quay o hihen his di need a quati, Nihil Kataho is soido, Nihil Nagot, any o hayu atidal chi do, yegodal chi a quande. A jashi would end as Nihije ani ya ani hinte. So bebe da hayanid edo hashin to go the engineers, Nishini hit or hihe. Of course, she says nido hashin to go at the shijates Diego Beta, Hosiado, that's how the Zendo, as far as Hosianto in his nature Hashin to go. A hope will yet there's a need of course he had none his don't need. I don't quite he had his net, Dr. Va. Thank you very much, Dr. Va. I don't shake a queer ask the son, none of Slethole. He has a cato shouldn't. JD Perfeya Fowler, that's a Genema Ideskis names not put a chain, but it's changed after that's a naledo, Kapaha, that's a che. For Totus Aholiena Ade, Yusuna Shako, Kodo A, Kashin to go a Tana Wishna by Henson, though that is not Spanido, there's Ani, Kodo Hata del Yai, by Henson, Adon Hinat Ani, no Finishing Nado, she Yash, President, Vice President, Hito Heha. Ado zeis engineers nishi is it na kahita no sini nishito heha. Ado nakadus nishi da no sini ado nakandas nishido ade da isno sai. Hashin tsoga nidi the kosin sanas et ada. Kojet nakans ni ashi ni do hot ego beji ilyante. Jo konde eshe o nakan nato tles jo at ende obi gahabeji edel quite yego not eon his at the hasti. Hashil Saga Nin his at the hasti, though ne daro edo needs not not need hindo, Hashil Saga ni hashke, Satobe not need him the joel as and he at the ho. A cook at nast egg adenes, non disease agit, a conzago, check Hajona haso tada bez anibik at the hinos etan hitine. Do zago hachahat zitole. Nate a squido sani dani alasate hachahat zine. Daninde a quande. So eshi o that edole. We have to learn to accept the virus. Joy dan hans ni. Hasto it adole. Nasko ne nijishi e yadi kwa yihahibi. Put a beat hati kay put a beat neta. O konasko net nijitina na hedos e het na neta dole. As twisani in the put a should so cash nalike. The yata huido asta no hot a kodoso that is zen. Put a naso nana tato jo e shi aste nana antien. O you go ye nan hines ta jo e di. Di zlipi ye hal ila sahat atol ni. So ni hite ni nishija Navajo Nation, but they need nishija nahona ataha nahon saho atol wasan na hutza okwande. Hajosnas on peso o you ado chose idishe by Henson. Do you go on his nanda itche and lay the meeting for the conference no ni an his the as jet o kodi kwan nas ni hi kodin hitol sandi hitol na ni hitans ni anta sho ni zi jo eshi ashi hot na has ani do hot des ni hot ho wa jo ta antin da ha ke shi edo shidne Niki Konesh Niki Tonas Kana go Batson that they cares ho what the Niki Man Niki Che Niki Nalle Niki Masani Keta hat in a go the art in Sunday cares Ado ho one oh you can't hear that here ho one in that ho one Sahata ho one Bakato in that she's those is a little by Henson. Here la ho one Batson that cares. Ist at the Haslahito a here a cook when the nasto ani nihits easto nihitsen casey yenest nihe or insa a quende nihits of the zane ati nihit naslado a be nit eshikado shidne kajo at that sort of zen nihits easy pa aquatia nihits easto sahot apenalnish. Akoti is the Bahasli Hatnini Ani Nishin Hihodni Jo is the Baholong Bahasli Kashini Teshi and Hedo Tatati Na Konde Jo on the Nasala Asto Adoti Ohot what Naido Hashin Sakon Hidden Lini Bella Ashline his aunt Nagis La his aunt Miketa Hasti Yegon Na Isna O Akwande Ado Nahatze Oya benastet na nishote shafen de benastet hashine landa nishik ad neznada tnaz neznan de zdo aton da de nishta atieta zet ya da beta zet len lokin khota ad da tan hit edo khodo ya da hasne alle nasn ende do akhode yan da hasne Accord Nihisi Zido Nihit Nahanasla Nato Sat the Nape Banate Edo Lele Enchon Chalchin Nahuinos and Edo Da Nihit Nahahasan Ne Nakwa Natwa Nahunesh Kishna Ganik Eda Lini Bahahasan Na Anne Be dancing Kesa the Nen Lini Hajoba dancing case. Adon Sodizene Ado Arcade na Han Hajon hit Sodizin. The Nabat Sodizin Ashi and Ni if Ani Edon he Otla Ad Edo Hashine La Ad Andan hit it nest Ha Edo Benash Nido Bakono Zishi Ado Di Nahoj an Atanelson the Winosen Hitin Edo Ani. If etan the Walmart I kedon here taho ade ishin yang tahija. Oko kwa etsesho he kwa jona antini ne dot nahat ato ashin nahat an lini hajon tato kaspehes anin tato kas to aj nahoji shik edo shidna, but it had to take a pandemic for us to realize what the real problem is. So change it to positive. Really look at places and things that you can improve and make changes on. And some of these changes are going to be permanent. Ako eshi ba ako nasandole shikedo shidne kon sagoshen hichahanana sidole shikedo shidne don juno niheta to ha ata hosia ado eseton alkanha no zen. Ako kodoshe president jana bichahanana shletole. Okay, should that's a bed no whole G, additional shiage, a call one so dole, she cater should not get quite not that so kizzy, not I can have